Our guest is Dr. Chad Bustani, who is a prosthodontist and the owner of Revival Dental and Implant Center in Canal City. We're going to be talking about the fascinating world of dental implants and how it can affect someone's life. Dr. Bustani, it's a pleasure having you with us today.
Thank you. Thanks for having me.
So our topic is dental implants. First, Dr. Bustani, tell us, what is a prosthodontist?
Well, a prosthodontist is somebody that basically went to undergraduate school, went to dental school, and then did 3 additional years of training in the field of prosthodontics. What is prosthodontics? It's basically prosthetics. So it's a dentist that specializes in both the surgical and the restorative aspect of replacing missing teeth or other oral structures.
So what are dental implants?
Well, a dental implant is a titanium structure that's embedded into the bone. So really, a dental implant is like a screw. It's just kind of like working in the garage. If I want to hang a TV on the wall, I have to install the screw, hit a stud, and hang the TV. So a dental implant is putting that screw into place and hanging a tooth on that screw.
That's important because it's titanium, because titanium doesn't rust.
It does not rust. So titanium is special. It is biocompatible. How is it biocompatible? It's biocompatible because there's a titanium oxide. There's a little oxygen molecule hanging off of the titanium.
And it's very expensive.
Well, that oxygen, the bone actually grows right to it. And so that's how it anchors into the body. It's just like getting a knee replacement. You get a knee replacement, it's titanium. A hip is titanium.
Well, the strength, these supersonic airplanes, their windows, those are made out of titanium too, because it's so strong. And I used to have a company that made titanium surgical instruments, eye instruments, because they don't rust and all, but it's very expensive.
You know,
all right.
There's actually, we now have implants that are not titanium. So some people don't want to have metal in their bodies. And we have another material called zirconia. So we have 2 types of implants. We actually have titanium implants and something called zirconia.
Does that change the price of the
It's more expensive to make the zirconia.
I've heard about it. That's very high. That's very specific too.
It's very specific. Then actually, we'll talk about it later, but that's what we make teeth out of too. So
wow.
We used to make teeth out of like acrylic. It would wear down. Now we have zirconia.
Does that set off those things when you go to the airport?
No, it doesn't.
Okay,
yeah.
Because my pacemaker does, and I have to be careful with it. So,
and you know, an interesting story about titanium.
Yeah.
You know, the invention of titanium was we didn't know that we could put titanium in the body. I mean, think some person, his name was, last name was Brandemark. He was doing experimental studies on rabbits, and he was putting these little titanium screws in their legs. And when he went to go take the screw out, he couldn't take the screw out of the leg. And he looked under the microscope, and he saw that there was the bone cell growing
into the
grooves.
Wow.
And then from there, we have dental implants, we have hips, we have knees, we have all these things that we use titanium for in the body, all from that chance discovery.
Okay, well, who would need dental implants or metal teeth? Who needs them?
Well,
who wants them?
Yeah. Well, it seems like everybody wants them.
Yes.
When they experience losing a tooth. A dental implant is a great and the best replacement of a missing tooth, or several missing teeth, or all your teeth. So the public service announcement, the thing I wish I could educate everybody about, and what is natural for people, is procrastination. When you lose a tooth, you lose the bone that holds that tooth into place. And so you only have a limited amount of time that you can easily place a dental implant. Once that bone is gone, it's very difficult to regrow the bone. Because what are you using bone for? You're using the bone to anchor the implant into place. You got to have something for it to attach to. And so the biggest advantage of the implant, beyond quality of life and replacing the tooth, is stopping the progression of more bone loss.
So that's why it takes, in some patients, time to do the implant. You can't always do it in one stage. There's a time element, like you have to put the implant in to stimulate bone growth.
Yes.
Let that grow. So it takes stages. In some cases, it's in stages.
Right. I mean, that's such a common question that I get.
Yes.
Because you see lots of advertisements nowadays, especially. Teeth in a day, implants in a day.
And we're going to talk about that.
And where 10, 20 years ago, or even depending on what provider you're talking to, the thought is that, well, this takes a long time. I had to have a tooth pulled. I had to wait 4 months. Then I had the implant put in, and then that had to heal. It took me 18 months to get something done.
Yeah.
Depending on the quality of bone structure, you can, in some scenarios, and depending where in the body we're talking about, but it is possible, whether it's a single tooth, multiple teeth, or all of the teeth, to extract a tooth, put an implant in, and attach teeth or single tooth onto that implant the same day.
So that's where it comes in. You can have all your teeth removed in one day and walk out with your new teeth?
Yes.
Permanent new teeth?
Permanent new teeth. So that scenario you're talking about, we typically
That's more common. They're doing that now.
Oh, that is one of the major procedures that we're doing in our office, and
In your office?
Yes, and in office, so we don't have to go to a hospital. So we have made our team surrounded around this type of procedure. We have our anesthetists, we have lab technicians, we have myself as a prosthodontist.
Lab tech, you mean you make your own dental implants?
We make the teeth that go on the implants.
Uh-huh.
So we put someone to sleep, we take out all the teeth, we put the implants in, and when they leave that day, the teeth are bolted into place and they're non-removable. Now, the important thing to note, those are the temporary sets of teeth.
Oh, okay.
We talked about zirconia.
Yes.
The zirconia teeth, which are these, as you can see.
Oh. Oh.
So the zirconia teeth, it's an incredible process to make this, by the way. We have big machines and big mills that starts in a big plate, a big block of stone almost, a big block of zirconia, and all these little arms mill that out. And they mill it to
I can
get
see
the
the
shape.
holes there, and you screw it in. That's the titanium or zirconium.
Yes, that's the zirconium. And so this is the new high-tech way of making teeth. Very strong, they don't wear down, and highly resistant to fracture. And you can feel that weight, I mean, just as you laid it on the table. So very strong. It is fantastic. We have complete control of the process because we're fabricating it
So
in-house.
are these the only ones that are used for removing all of them at one time?
I don't want to necessarily call it the old way.
Yeah, yes.
But the old way used to be like a titanium bar and then acrylic teeth. But the problem, those teeth broke. I mean, you can put a lot of force in your mouth.
Yes, you can.
And so when you're eating steak or hard food or jerky, you're hard bread, just chewing.
And have those big eye teeth hit those below and break it.
Yeah.
One time I thought it might be a dentist. I knew there were eye teeth, but there were too many. I just needed to concentrate on the two eyeballs.
Yeah.
So, okay. So is it common for people to have a whole mouth done?
Yes. I mean, I spent about 10 years in Colorado after my residency. And then I came back to West Virginia in 2020. And I found out when you say, are people needing their whole mouth done? People need their whole mouth done whether you're in Colorado or here in West Virginia.
Yes, probably more so than in Colorado.
Well, we do have the stereotype in West Virginia of losing teeth.
Yeah.
But I find the problem is it's a worldwide problem. And so regardless of where you live, when you're faced with losing all of your teeth, in general, there are three options for that person to think about. And those three options are a denture, like what you see right here.
False teeth.
False teeth. The false teeth you've always heard of.
Yes.
So, and that's the fear. People are afraid of, oh my gosh, am I going to have to wear the dentures that my grandparents had to wear?
My dad got those when he was in his 50s. That one of his teeth, it was his gums. Mm-hmm. They had to do it. And I was amazed that he coped with it because he lived to 96.
Well, that used to be our only option.
Yes. And so how many types of implants are there? I mean, you've got all these samples here. So I could get 1 tooth, 4 teeth, all teeth. You can do a whole lot of different things.
Well, I think that question, it gets confusing. Well, what is all these things? I think, in my mind, keep it simple.
Okay.
When you lose all your, we're talking about losing all of the teeth. When you lose all of your teeth, there's 3 options. Forget about implants. People want teeth.
Yes, we need teeth.
You want teeth.
Yes.
The implants are just supporting beams to make the teeth more comfortable. So when you lose all of your teeth, you've got a denture, something called a snap-in denture, or you can have teeth that are fixated into place. The teeth that are fixated into place are what we've been talking about here. But there are other options. Everybody's concerned about cost.
Yeah, big time.
Big time. I mean, that's the major conversation with patients every time. And that's why we talk about 3 options, is we want to provide them a range of costs that fit into different people's budgets. And each option can lead into the next thing. So you can start with a denture. A couple years later, you can add a couple implants and go to a snap-in. A snap-in is something like this, where you have as little as 2 implants. It still looks like a denture, and you see there's little snap pieces.
So now, if I had that, would I have to take that out every time after I ate and at night?
No, typically at nighttime. You want to give yourself a break. Or when you're in the car. I mean, if you left your shoes and socks on 24 hours a day, it'd get sore.
Is that something that you could leave in permanently?
You still need to give yourself a break. And that's what's nice.
No, I meant instead of going to the other.
Oh, yes, absolutely. So it's an option that people live with for their whole life. Especially on the bottom. A lower denture is very difficult to wear. It's the most common complaint patients have. There's people in your audience.
It clicks when they talk.
They talk. There's probably people that have their upper dentures in, and their lower dentures in their pocket.
So, and this would be less costly than the full mouth one.
Yes.
And now, that's an interesting question because these things are obviously costly. Mm-hmm. Tell about how you handle that. I mean, you can't put a fixed cost. One office isn't going to be the same charge as another. How do you figure out what it's going to cost for the patient?
Well, when a patient comes into our office for a consultation, they come in, we take a CT scan, we see what they're a candidate for, because depending on how much bone structure someone has and the extent of the surgery that's needed, that affects things. And that's one reason why I say it's important to save the bone you've got and do some of this treatment early. It makes it cheaper, basically.
So if I have a problem or had problems in the past and just remove my teeth, then that affects the bone under it. You lose some of that bone.
You lose some of that bone. And so it reduces the number of procedures someone has to have, the sooner we can do things. So when you come in for your consultation, we take our scans, we figure out a treatment plan. We typically have a treatment consultant that can sit down with someone and they review each option, financing options, insurance options.
Also, you have options for them. Yeah, I know, like the dental insurance companies like Care, will they do that even for the eye surgery? They have special programs to help people. I guess their loans on their treatment.
Yes. So there's all kinds of medical and healthcare financing.
That's
plans.
important because Medicare and normal health insurance doesn't cover the cost of all this, do they?
They may help. They're almost like discount plans.
Yes.
So there's a certain amount of financial assistance that each one of those institutions will provide. And in the end, it makes treatment cheaper. And that's where, with our staff, I mean, we have people that are researching, like, what are all the options someone's have? Your
Yes.
healthcare plan, some employers provide health benefit. And
Well, you mentioned something, the 3D imaging and the CT scans. Is that something that every office does or has equipment for? Because that's costly.
Not every office has that, and you're right. The limiting factor is the cost associated with it. I mean, there's a reason some big hospitals have more machines than other hospitals. Yeah.
So if they're not going to do implants, they don't need those in a regular
Correct.
office.
So anybody providing care that we're discussing here, really in this day and age, has to have a CT scanner. And
You have your own lab in-house?
yes.
Because I can remember in the past when they've had to do some work on my teeth, they take the impression, they make it. You have to wait a week or so for it to come, get another appointment. You do that right in your office?
We do it right in the office. It helps the patient so much. That waiting time is detrimental. People have to go to work. They have family events. They've got things going on. So we ensure, for the most part, that no one walks out, after treatment, no one walks out without teeth. Even if they're temporary, there's something in your mouth. One interesting thing with the scanner and then having the lab in-house,
Yes.
and this is amazing, that now what we can do with other technologies, other machines, we have 3D printers and 3D graphic design. So we take that scan, and some people that don't have much bone, we have other implants also called zygomatic implants or pterygoid implants. That implant, when someone has waited and they don't have enough bone or they're just born that way,
Yes.
we can place an implant that actually goes into the cheekbone. And it still allows us, many patients will go 20 years and they say, I've always been told I don't have enough bone for implants. We take a scan, we actually 3D print the skull. And then we actually in the lab. So we take the scan, we print their shape of the bone, and we do the surgery on that model.
Well, they're even building houses now with that printing machine.
Oh, yeah.
Yeah, it's amazing.
It's amazing.
So, okay. You are a specialist, obviously. That's your main thing. But do you do other dental work?
We do other dental work. So in the field of prosthodontics, any prosthetic. So some people may have cancer and they have a hole in the roof of their mouth, or they have cleft palates. So we make prosthetics that plug those holes that can't be fixed with surgery. So we call them obturators. We make those types of prosthetics. We do even down to smile design. Somebody wants to
You're going to change my smile?
change your smile. So if somebody
How
has,
do you do that?
well, somebody may have all their natural teeth,
Yes.
but they're discolored from maybe even antibiotic use as a child or just wear and tear over time. They're worn down. You can build crowns or veneers. They go over top of the teeth. They're still your real teeth, but they're fixated onto the teeth, essentially glued. And it's almost like a fake fingernail.
Well, I am amazed because I'm much more aware now when I'm watching TV, singers and talkers and all, at how good their teeth are, how they look and they're straight.
Yeah.
In the old days, you could even see the cavities and the fillings when they'd open their mouth. You don't see that anymore.
Yeah. Well, your teeth, maybe like your eyes,
Yeah.
we look at people in the eyes. What do you say? Make eye contact. Smile. Your first impressions are up here. And so we use our teeth to chew, to smile, to interact, to, attract our mate. It's how people see us.
Yes, in many cases, particularly in the office, when I would see some of the older people, or even some of them, that they didn't have their teeth, they'd always hold their hand up in front of their teeth.
Oh, yeah.
Now, when I was growing up in high school, if one of the kids, particularly from one of the coal camps. I grew up in a coal camp in Monarch. I went there every day with my parents. They wouldn't fill the teeth or fix it. They would pull it.
Yes.
And some of them, for their graduation gift, they pulled all their teeth and had false teeth made for them.
Yes.
Have you ever heard that
I've
story?
heard that story many, many, many times.
Oh, really?
Yeah.
Okay. I don't know if they still do that, but when I went to school in the 1950s, that was not uncommon.
Yeah. And I see those patients all the time. They say, when I was 18, 19, I got all my teeth pulled. And those are the people I'm talking about that say they've always heard they don't have bone for implants.
Yes.
But with today's technology, almost everybody does. And so that's the two big things are you got to have a CT scan to really know.
So by having all of these different pieces of equipment that tell you these things, that must be beneficial to the patient as far as timing and all, and the end result of their implants.
Absolutely. I mean, it is interesting and there's studies about this, of how much time, somebody with false teeth, how much time in their day they have to think about their false teeth. From the time they wake up, pulling the teeth out from a cup of water, putting them in, putting the glue in, wondering when they're talking to somebody, did my teeth just move? Are they dropping? Cleaning them after a meal.
Or just chewing. I always feel like I have more lip than teeth, and I'm constantly biting my lip.
Mm-hmm.
And so little things like that, it's an important thing to people, and I guess they sort of get used to all of it. We had talked about some of the different types of implants, but there was the one that I call, it was the all-in-4.
Yes.
What's that?
All-on-4. It's been a advertised term. You hear all-on-4.
Oh, okay.
All-on-4 is all of the teeth on 4 implants. It is a technique or a concept that essentially makes it cheaper for a patient to achieve a fixated set of teeth. Used to be you'd have to put more implants in.
Okay, I have 10 teeth. You'd put 10 implants in.
Correct.
Or the all-in-4
is 4 implants with 10 teeth, with 12 teeth.
So you had 4 screws, and the rest were veneers or a bridge.
A bridge.
A bridge.
And it's basically these models that you see here. It's this specific model. I like to call it, we like to call it now more than all-on-4. We call it all-on-X.
Uh-huh.
All-on-X meaning if somebody has enough bone, we'll place an additional implant. Maybe it's all-on-5. Maybe it's all-on-6. But the point is you don't need an implant for each tooth. It allows you to attach the teeth the same day. It allows you to provide a cheaper treatment option for a patient, and allows you to shorter treatment times. I mean, it used to be you would take the teeth out, let it heal.
Yes.
Then you put the implants
in.
in.
The question is, like on the same day concept, other than the money involved, who could do that? Who would be a candidate for that?
In 2024,
Yes.
almost anybody, regardless of the amount of bone loss, you can get implants in their body. There are different implant types that have opened the door, especially recently. It's really, honestly, an exciting time to be in the field of dentistry because it's a renaissance of technology. I mean, it's really unbelievable. Things that we couldn't do, I mean, I'm talking 5-10 years ago when I got out of residency, and what you can do today. So essentially anybody losing a tooth, multiple teeth, or all of your teeth, almost everyone is a candidate for an implant. But I still want to stress, the more bone you have and the earlier you seek treatment, the better the prognosis and the easier the treatment is.
Are all implants successful?
You do enough procedures.
Yep.
Even the best driver, has an accident.
Yeah,
Or,
okay.
A knee replacement, maybe have to have revision. So you have a better prognosis with the more bone structure that you've got. Our success rates
How long will an
globally,
implant last?
well, our success rates globally are about 97, 98% success rate. It's incredible, really,
Literally, that means years or a person's lifetime?
in a person's lifetime.
Okay, if I have implants and have a problem, can you fix it
Yes.
or straighten them, or do you tighten that little screw up?
We normally replace the implant completely. And that's the nice thing. The presence of the implant stops the progression of more bone loss. So now you've had an implant, well, you're saving all the bone around it. So we have other areas that you can always work with. So it's preservation.
So does that titanium or zirconium implant stimulate bone growth so it doesn't wear away?
It holds what's there. It doesn't necessarily stimulate to grow more bone, but it stops the progression of what's lost. And so that's our major goal. Our major goal is to not allow bone to continue to go away versus growing more.
Who should not have dental implants?
Well, uncontrolled diabetics,
Okay.
so which we can get things under control. Osteoporotic patients that are on a certain medication, sometimes it's called bisphosphonates, like Fosamax, for example. Those medications had to be stopped for about 3 to 6 months prior to a procedure. So there are some systemic issues that don't necessarily make it to where you can't ever have implants, but it just may delay the timing of the surgery.
Okay, so I have implants now. How do I keep my mouth and those implants healthy and intact?
Well, depending on the type of procedure that we have done, I recommend about a 4-month recall. So you still have to see a dentist. You still have to get the teeth cleaned.
What about smoking?
Smoking used to be a complete contraindication. Now we still recommend stopping smoking. I mean, that's just. But
Well, that's good anyway.
But not that I promote it, but you can still smoke with implants. But it does increase the chances of problems.
Well, it sounds like you're in the business of making people happy, even though it can be uncomfortable at times.
Yeah.
And I want to thank you for taking all your time to be on our show, because I know your time is limited. And I want the audience to remember his sister, Amanda, was on our show many years ago, as was his dad, Dr. Bustani, the general surgeon. Thank you once again for being on Vital Signs.
Thanks for having me.